Swine flu and bird flu. There are four types of influenza viruses A, B, C, and D. Human influenza A and B viruses cause seasonal epidemics of diseases known as flu season almost every winter in the United States. Influenza A virus are the only influenza virus known to cause flu pandemics, global epidemics of flu disease. A pandemic can occur when a new and different influenza A virus emerges that both infect people and has the ability to spread efficiently among people. Influenza C virus infections generally cause mild illness and are not thought to cause human epidemics. Influenza D virus primarily affect cattle and are not known to infect or cause illness in people. Influenza A and B viruses have two types of spike that cover their surface, hemagglutinin H and neuraminidase N. There are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes. While more than influenza A subtype combinations have been identified in nature. Swine flu. The H1N1 flu, commonly known as swine flu, is primarily caused by the H1N1 strain of the flu influenza virus. The swine influenza virus, which was first isolated from pigs in 1930 in USA, it has been noticed that people who are in close proximity to pigs, for example farmers, pork processors, etc., usually get the infection, thereby causing similar symptoms. The cross species infections, swine virus to human, human virus to pigs, avian virus to human and pigs were found globally. Swine flu strain causing 2009 pandemic was first seen in Mexico, USA. It has been termed novel H1N1 by researchers since it's mainly found infecting people and it exhibits two main surface antigens H1, hemagglutinin type 1 and N1, neuraminidase type 1. By June 2009, the virus had been reported in most countries in the world, but luckily the mortality rate of H1N1 has remained low and similar to that of the conventional flu. In 1918, there was an epidemic of Spanish flu with a mortality rate of around 2 to 20%, whereas swine flu or H1N1 has mortality rate of less than 6%. Swine flu is caused by a type of influenza A virus which is designated as H1N1. It is mainly identified by its surface antigens by immunological techniques. This virus is in 1918 there was an epidemic of Spanish flu which is with a mortality rate of around 2 to 20%, whereas swine flu or H1N1 has mortality rate of less than 6%. Swine flu is caused by a type of influenza A virus which is designated as H1N1. It is mainly identified by its surface antigens by immunological technique. This virus is transmitted from person to person either by inhalation or by ingestion of droplets when the infected person sneezes and coughs. It is important here to note that swine flu is not transmitted by eating cooked pork. Structure: the influenza virion is spherical and an enveloped virus. Anatomically, swine flu virus consists of 8 RNA strands joined with numerous proteins B1, PB2, PA, and P and has two main surface antigens H1, hemagglutinin type 1, and N1, neuraminidase type 1. Neuraminidase type 1. The interior of the virion comprises of additional protein called NEP. M1 protein, matrix protein, gives strength and rigidity to the lipid envelope. M2 protein targets antiviral drugs. Neuraminidase is an enzyme that supports the virus to break cell walls and it is also called as siaridase because it breaks the linkages between sialic acid and cellular glycoproteins as well as glycolipids found in cell walls. Neuraminidase is a mushroom-like projection on the surface of the influenza viruses. Hemagglutinin is a glycoprotein that fixes the virus to the cell being infested. The hemagglutinin molecule is actually a combination of three identical proteins which are bound together to form an elongated cylindrical shape. Swine flu virus or swine origin influenza virus belong to influenza family which is common in pigs and their subtypes are H1N1, H1N2, H2N1, H3N1, H3N2 and H2N3. You can see a structure NS2, lipid bilayer Na, neuraminidase, hemagglutinin, M2 ion channel, M1 matrix protein, infected cell protein NS1, NP nucleocapsid, PB1, PB2, PA transcriptase complex. The life cycle of swine flu virus H1N1 can be initiated very effortlessly because it is predicted to live outside of human for 2 to 48 hours, and it can attach itself to any surface like towel, clothes, table, doorknob, or anything touched by an infected person. The swine flu life cycle mainly has 7 phases, which are the swine flu virus antigen is attached to the surface of cells on the nose, throat, and lungs. The cell engulfs the virus. The virus is able to penetrate the bubble of cell membrane that encloses it and release its RNA into it. In the nucleus, replicas of the viral RNAs are made. Then viral mRNA causes the cell to prepare viral proteins. These proteins and RNA migrate to cell surface where they are amazed to novel virus particles. Novel virus start budding off from the cell surface. Influenza virus. How it spreads? By airborne respiratory droplets, coughs or sneezes, by touching a contaminated surface, by saliva, kissing or shared drinks, by skin-to-skin contact, handshakes or hugs. Symptoms. The signs and symptoms of flu caused by the H1N1 virus are similar to those of infections caused by other flu strains and can include fever but not always, chills, cough, sore throat, runny or stuffy nose, watery red eyes. Okay, then treatment. Typical treatment include rest, pain relievers and fluids. In some cases, antiviral medication and IV fluids may be required. Self-care, menthol and rest. Then medications, antiviral drug, cough medicine, decongestant, analgesic and non-steroidal anti-inflammatory drug, supportive care, fluid replacement. Specialties. Drugs are used, Tamiflu and Relenza. Because flu virus can develop resistance to these drugs, they are often reserved for people who are at high risk for complications from the flu. People who are otherwise generally healthy and get swine flu will be able to fight the infection on their own. Control measures: wash your hands thoroughly and frequently. Use soap and water. If they are not available, use an alcohol-based hand sanitizer. Cover your coughs and sneezes. Cough or sneeze into a tissue or on your elbow. Avoid touching your face. Avoid touching your eyes, nose and mouth. Clean surfaces. Avoid contact. The Centers for Disease Control and Prevention recommends annual flu vaccinations for everyone from age 6 months or older. Each year's seasonal flu vaccine protects against the 3 or 4 influenza viruses that are expected to be the most common during that year's flu season. The flu vaccine can reduce your risk of the flu and its severity and lower the risk of having serious illness from the flu and needs to stay in the hospital. The flu vaccine is available as an injection and as a nasal spray. The nasal spray is approved for use in healthy people ages 2 through 49 years old. The nasal spray isn't recommended for some groups such as pregnant women, children between 2 and 4 years old with asthma or wheezing, and people who have compromised immune systems. And bird flu. Avian influenza, also called a bird flu, occurred in wild aquatic birds and can also infect poultry, other birds and animal species. It is caused by influenza A virus subtype H5N1, commonly known as highly pathogenic avian influenza virus. This virus is a subtype of influenza A virus. The new H7N9 strain emerging in China does not make birds ill but has been killing about the third of infected humans. Structure: RNA polymerase PB1, PB2, PA, non-structural proteins 1, NS1, NS2, NEP, nucleoprotein NP, then matrix protein, VRNPs, hemagglutinin, HA, neuraminidase, M2, lipid bilayer. H5N1 is a subtype of the species influenza A virus of the influenza virus A genus of the Orthomyxoviridae family. Like all other influenza A subtypes, the H5N1 subtype is an RNA virus. Life cycle: the influenza virus life cycle can be divided into 5 stages. Entry of virus particle into the host cell, entry of viral ribonucleoprotein into the nucleus, transcription and replication of viral genome, export of VRNPs from the nucleus, assembly and budding at the host cell plasma membrane. Avian influenza A virus have been isolated from more than under different species of wild birds. The majority of the wild birds from which these viruses have been discovered represent gulls, terns, and shorebirds or waterfowl such as ducks, geese, and swans. These wild birds are often viewed as reservoirs or hosts for avian influenza A virus. Pigs to human, domestic fowl to human, wild aquatic animal, birds. Okay. Symptoms: you may have an H5N1 infection if you experience typical flu-like symptoms such as cough, diarrhea, respiratory difficulties, fever over 100 degrees Fahrenheit or 38 degrees Celsius, headache, muscle aches, runny nose, sore throat. Treatment: evidence suggests that some antiviral drugs, notably neuraminidase inhibitor, zanamivir, can reduce the duration of viral replication and improve prospects of survival. However, ongoing clinical studies are needed. Emergence of oseltamivir resistance has been reported. In suspected and confirmed cases, neuraminidase inhibitors should be prescribed as soon as possible, ideally within 48 hours following symptom onset to maximize therapeutic benefits. However, given the significant mortality currently associated with AH5 and H7N9 subtype virus infections and evidence of prolonged viral replication in these diseases, administration of the drug should also be considered in patients presenting later in the course of illness. Treatment is recommended for a minimum of 5 days but can be extended until there is a satisfactory clinical improvement. Corticosteroids should not be used routinely unless indicated for other reasons like asthma and other specific conditions, as it has been associated with prolonged viral clearance, immunosuppression leading to bacterial or fungal superinfection. Most recent A and H5 and H7N9 viruses are resistant to adamantine antiviral drugs and are therefore not recommended for monotherapy. Presence of co-infection with bacterial pathogens can be encountered in critically ill patients. Control: apart from antiviral treatments, the public health management includes personal protective measures like regular hand washing with proper drying of the hands, good respiratory hygiene covering mouth and nose when coughing and sneezing, using tissues and disposing them correctly, early self-isolation of those feeling unwell, feverish, and having other symptoms of influenza, avoiding close contact with sick people, avoiding touching one's eyes, nose, or mouth. Healthcare workers performing aerosol generating procedures should use airborne precautions. Standard contact and droplet precautions and appropriate personal protective equipment should be made available and used during epidemics. Thank you for listening.